Population aging is happening across the world. But in the Middle East and North Africa, it's happening at a much faster rate. While it has taken Europe more than a century to shift these demographics, countries in the MENA region, as it's called, will experience the same change in a fraction of that time. Countries like Turkey and Egypt have yet to develop their infrastructure or conduct necessary research to support this surge in older people.
We know from the age structure, you know from the data, that in the near future the percentage will increase. But that's not the issue. The issue is if you want to worry about the old age, you have to start from now. If we wait till the percentage become a real challenge, then we don't have anything in place to be able to deal with that percentage. So we're quite convinced that the time is opportune to start now.
تخلي الناس المسنين دول عندهم خبرات كتير جدا يستفيدوا بيها، عندهم لقاء يعني في حياتهم في حاجات لو هم أذاعوها للصغيرين هتكون سبب في إنه تساعدهم على تخطي المصاعب اللي في الحياة.
هو المفروض يتعمل حساب الناس الكبار في السن من ناحية إيه؟ الأرصفة، يعني يعملوا الرصيد عالي طوله مثلا متر إلا ربع. طب الكبير في السن ده يطلع ازاي؟ المفروض يبقى حاجه قريبه من الانسان. يبقى في نادي قريب من منطقه الواحد ما يركبلوش مواصلات يتمشى. يبقى في جناين.
It's very important to talk about the caregiver. We don't have any research about that. Only very sporadic that happens in few studies. One of them that we had in Ismailia, it was about 17 years ago. The data was extensive, but it was on a very small community in rural Ismailia and urban Ismailia. It's not sufficient. We're looking for a huge effort in which we register the regional differences, the cultural differences within the Egyptian society. We need to study that.
في مجتمعنا الشرقي موضوع ان حد يراعي مامته ده طبعا شيء معتاد، يعني في اغلب البيوت وفي ديننا برضو بيحسنا على ذلك. بس بنيجي برضو فترة ان احنا بنبقى محتاجين خصوصية او راحة او بريك او كده، فمين طيب يراعيها مثلا في الفترة؟ مثلا لو انا هاخد مع اسرتي اجازة او كده.
انا مهندسة، انا واخواتي، احنا 3 بنات متزوجات، 2 منا متزوجات، واحدة عايشة بره مصر. احنا ال3 تقريبا حياتنا اتغيرت في محاولة رعايتهم. يعني أنا اضطريت في وقت ما إن أنا عشان ما أكونش، لأن كان شغلي بعيد عن والدي ووالدتي، إن أنا أسيب الشغل اللي هو الفول تايم وأبقى بشتغل فريلانسر أو من البيت أو كده عشان أكون قريبة منهم. عشان مثلا أوفر لهم مكان بيكون فيه أسانسير ومسهل الحركة ليهم، اضطرينا ننقل لمكان بعيد وده عبء مادي، عبء أغير حياتنا كلها.
لأن مصر هي اللي فيها ناس بيحبوا بعض وبيتعاطفوا مع بعض. يعني مش ممكن تلاقي جيران ساكنين جنب بعض وما يتواصلوش مع بعض ويعرفوا ده تعبان يروحوا يزوروه، ده عاوز حاجة يجيبوها له، والصغيرين دايما يحبوا يخدموا الكبار، فبالتالي الحياة مريحة والحياة حلوة.
It's not just in Egypt, by the way. We're talking generally in the Arab region. So it's a combination of factors. You need lots of knowledge to inform the policy. That knowledge needs to be reflective of the context we're living in. We also need to make sure that you put on the agenda of the policymaker the importance of dealing with these issues and preparing for it from now.
Hello and welcome to a very special virtual event. You join us as we launch MENARAH, the first of its kind research group exploring healthy ageing in the Middle East and North Africa. The international network brings together a whole host of researchers, carers, advocates and policymakers with the aim to raise awareness of the economic and social implications of changing demographics in the region. They also hope to help improve the lives and well-being of the elderly and their informal carers across countries like Egypt, Lebanon and many more. We'll be joined shortly by members of the group, but before we do, just a few items on housekeeping. Due to the ongoing situation with COVID-19, we're all social distancing and on the line from various locations all over the world, so do bear with us if we encounter any technical issues. To those of you watching us live on Facebook and YouTube, if you want to get involved in the conversation and send in questions and comments for our panellists, you can do so by writing in the live chat section on whichever platform you're watching on, and we'll get those answered for you by our esteemed panellists. But now let's begin, and I'm delighted to say for our first panel, we've got Professor Hoda Rashad from the American University in Cairo, Dr. Christopher Mikten from the World Health Organization in Geneva, and MENARAH's founder, Professor Shereen Hussein from the University of Kent, who I'm going to hand over to for some opening remarks. Shereen, it's over to you.
Thank you very much for joining us today. My name is Shereen Hussein, as Cameron said, and I'm a professor of care and health policy evaluation at the University of Kent. I have been researching issues of aging and long-term care for over 20 years in the UK, Europe, and in other parts of the world, including the Middle East and North Africa region. It is really with great pleasure that I welcome you to the launch of the MENARAH network, which I'm leading, as Cam said. The network is really the fruition of considerable partnership building efforts across the region and internationally, which spanned over a number of years. The network aims to address the significant phenomena of population aging, which has direct and indirect implication in all segments of the society. Yet very little evidence is available to support developing tailored policy and effective practice solution in the MENA region. The MENA region, or the Middle East and North Africa region, comes with its richness, history, and mixture of political and socio-demographic positions. It spans from Mauritania and Morocco in the west, to Iran in the east, Turkey in the north, and Sudan and Yemen in the south. It is quite a diverse group of countries. Yet they share several cultural and socio-demographic similarities. One of these, one fundamental similarity is valuing and respecting older people to the extent of treasuring older people. And while this belief exists, current infrastructures and health and care systems do not facilitate translating such strong values into real experience of healthy and meaningful aging process. So the MENARAH network emphasizes the importance of healthy aging in its broadest meaning: psychological, physical, well-being, and social aspects. A core part of this is the creation of accessible opportunities for older people from various walks of life to participate effectively in more comprehensive social and economic activities. Such opportunities should acknowledge and attempt to counter the impact of cumulative disadvantages among different groups of older people. Research and partnership working are urgently required to establish sound knowledge base to enable system changes and to meet expected demands, while at the same time ensuring older people's well-being is at the core of any development. So the MENA region, along with many low and middle income countries, faces a number of questions, like what are the best models of care and support? How would they work for different groups of people? How can we support informal carers and their family? How to create a skilled cadre of workforce, health and care professionals who are skilled, but at the same time compassionate and proud and able to meet the complex needs, and how to finance these sustainably. So all these are very fundamental and complex questions that we hope the MENARAH network would be able to support developing answers and solutions to. The region is experiencing considerable economic, social, and demographic challenges. One of these is the simultaneous, fast, and steep growth in older age groups, while observing a youth bulk, with large cohorts of young adults requiring education, training, job opportunities, and housing, among others. So these challenges also create opportunities, especially in societies like the MENA region, where intergenerational exchange is part of its life fabric. Caring for older people in the region remains a family matter, particularly for younger women in the family, thus supporting the whole family unit and creating ways to facilitate intergenerational exchange and promoting women's contribution to the labor market and the wider society have positive and tangible economic and societal returns. In addition, older people themselves bring considerable benefits to the family and the whole society. Evidence from across the world shows that older people play instrumental roles in supporting younger generations, from financial help to in-kind support through, for example, much needed childcare or accommodation, or the endless emotional support. Older people also have valued professional and personal expertise. So creating opportunities for older people to participate outside of the family sphere would bring added value to the whole society. While all of these challenges require immediate actions, very little data and research are available to formulate, design, and implement effective policy and practice solutions. More importantly, what we find that the voices of older people themselves and their families is missing from all research. The MENARAH network aims to fill this gap and creates mechanisms to facilitate much needed discussions, collaborative opportunities, and scientific research into the various aspects of aging and long-term care. We bring expertise from international and regional stakeholders with a specific interest in enhancing the lives of older people and their families. And we continue to forge strong relationships with relevant global, regional, and national bodies. One of the network aims is to build both research and policy capacity within the region and to facilitate knowledge translation into tangible responses, connecting all stakeholders, as well as raising public awareness. And really our ultimate goal is to help creating an environment that enhances the quality of life of older people and their families in a fair and an equitable manner. Without further ado, we have a fantastic panel to speak today. So I'll hand over to the next speaker.
Thank you very much, Shereen. We're going to head to Egypt now, and Professor Hoda Rashad, I'm handing over to you for your introduction.
Well, thank you very much, Cameron. I'm Hoda Rashad. I'm the director and professor at the American University in Cairo. Well, good morning, everyone, and good afternoon. It's a real pleasure to be a member of this initiative and to be invited to say a few introductory words. Before I start, I think it's appropriate to compliment Dr. Shereen Hussein for her leadership. Dr. Shereen has initiated the network and championed all of its activities. My few and brief introductory words will touch on two key messages. My first message is that MENARAH can contribute to advancing the agenda of healthy aging in our region. So let me reflect a little on what MENARAH can do. MENARAH contribution is mainly through the engagement with the regional impediments that do not allow healthy aging to occupy an adequate space in the development agenda. We all recognize that. But what are the key impediments that are contributing to non-centrality of the aging agenda? First, as Dr. Shereen mentioned, we do have a young age structure and the youth bulge. And understandably, this diverts the attention from older age groups. Second, we are experiencing a measurement trap. In this trap, the lack of knowledge on the livelihoods and well-beings of the older population is feeding the neglect and invisibility of this challenge. Thirdly, the region is facing a good number of urgent competing priorities. These priorities are monopolizing the development energy and resources. To mention a few, we have challenges related to poverty, to gender, to humanitarian emergencies and conflicts. So the question is, in view of this contextual environment, what can MENARAH contribute? Well, just a few ideas. In terms of the age structure, I believe that MENARAH can change the discourse from its focus on just the size and number of older population to a concern with their well-being and the quality of their livelihoods. MENARAH can also emphasize that the preparedness and ability of social and healthcare system to cope with the increasing demand of a fast-growing group is determined by acting now. In terms of competing priorities, MENARAH can ensure that the older population is adequately mainstreamed in policies and programs addressing the perceived more urgent development challenges. In terms of the measurement gap, the needs are abundant. I mean, there are so many areas where we can cover. However, I believe it's important that the emphasis of MENARAH is on practical policy solutions that are anchored on human rights principles, participatory approaches, and the movement away from the welfare paternalistic approach to an asset and empowering approach. Having said so, we should recognize also, and this is really my second message, is that there are opportunities and points of strength already existing in the region, and MENARAH should capitalize on this. Few examples of these opportunities come to my mind. First, many countries do have national strategy and action plans, and they do have structures whose mandate can cater for the old age. I believe that these resources are likely to be further activated by incorporating in them the SDG pillars of well-being for all and leaving no one behind. The second point of strength relates to the fact that we do have many national and research bodies specifically targeting the older age group. Actually, if you look at the recent past, one cannot fail to notice the scientific scholarly outputs in the last decades have increased in quantity. Not just that, it had also improved greatly in the adapted conceptual framing. Thirdly, another point of strength is that the UN body and its many organizations are really playing the role as welcome development partners in the region. I know that ESCWA and WHO are represented in this panel, so I will focus my attention and ask you to note the recent valuable efforts of UNFPA of the Arab region. Actually, if you look at the site, there was a regional consultative meeting organized last year by MENARAH in Cairo. During that meeting, a detailed discussion of the UNFPA for the Arab States region and the League of Arab States, a detailed discussion of their ambitious strategy and action plan was presented. This strategy can really guide many of MENARAH's future contributions. The details of the consultative meeting and the strategy itself are available in the MENARAH virtual site. Speaking of virtual sites, and noting the increase of their presence and importance as a convenient hub of interaction and sharing, MENARAH is careful from the start to complement and reinforce the existing sites. An important regional site that my organization is involved in has joined forces with MENARAH. This is the AMR SDG learning platform. Actually, and thanks to MENARAH, the SDG learning platform is currently working hard to prepare to add a new topic in its list of health topics, and the topic is on healthy aging. Of course, we are discussing with the MENARAH how the two sites can reinforce and complement each other. So, to conclude, MENARAH is a very welcome initiative. It can undertake activities responsive to contextual specificities. It can capitalize on the many regional opportunities and also benefit from international experiences. Indeed, MENARAH is looking forward to a wider pool of members, more collaborative efforts, and the support of development partners. And I'll stop here and I hope to move to the next speaker. Thank you very much.
Thank you very much indeed, Hoda. Now, before we go on to our final panellists, just a reminder that if you have any questions or comments you'd like to make and get answered by our panellists, please do send them in via the live comments section on the YouTube and Facebook streams. Right, as I said, over to our final panellist, Dr. Christopher Mikten from the World Health Organization, who joins us from Geneva. Christopher, I'll let you start your presentation.
Okay, thank you very much, Cameron. Are the slides going to appear? Or? Yes, thank you. Okay, well, good morning or good afternoon, everyone, depending on where you are in the world. I'm Christopher Mikten. I work for the Demographic Change and Healthy Aging Unit within the Department of Social Determinants of Health at the World Health Organization headquarters in Geneva. I'd like to start by thanking Professor Hussein for inviting WHO to participate in the launch of MENARAH today. Next slide, please. Yeah. So, as previous speakers have mentioned, the world population is living longer. The world population is aging and at a pace really never seen before in the history of humanity. And this is having all kinds of far-reaching implications, especially for the health sector and the long-term care sector. Just some examples. It's projected that by 2050, the population of people 60 and over will have doubled to 2.1 billion. Population of people 80 and over will have trebled by 2050. And about 80% of older people will be living in what in the UN world we call low and middle income countries in 2050. So population aging is in no way only a problem of high income countries. Next slide, please. And this map, which I hope you can see, shows on the left the proportion of the population 60 and more in 2015, and on the right projections for 2050. And if you look the Middle East and North Africa region, you see, for example, Iran, 2015 had less than 10% of the population over 60. It's projected to have over 30% by 2050. Another example, Morocco, Algeria, Libya, less than 10% in 2050, between 20 and 24% in 2050. So in the region, as in the rest of the world, there is really rapid population aging taking place. Next slide, please. And in response to this population aging and the far-reaching consequences for society, WHO and other UN partners are in the process of launching what we're calling the Decade of Healthy Aging. Next slide. And little aside, just for kind of clarification of concepts, healthy aging we define as the process of developing and maintaining the functional ability, even in the presence of disease or disability, that enables well-being in older age. And functional ability is really the outcome of an interaction between intrinsic capacity, intrinsic mental, physical capacities, and facilitators and barriers in the environment. Next slide. So the Decade of Healthy Aging is really an opportunity to bring together governments, private sector actors, academia, professionals, international agencies, civil society organizations for 10 years of focused action to improve the lives of older people, improve the lives of older people's families and their communities. Next slide. And this decade has four main areas of action. First deals with ageism, really changing how we think, feel, and act towards age and aging. Second one deals with communities, developing communities in ways that foster the abilities of older people. The third concerns health, delivering integrated care and primary health services responsive to older people. And the fourth was long-term care, providing older people who need it with access to long-term care. We're also developing a platform which will connect stakeholders and enable work on a number of cross-cutting issues. First of these is listening to older people and engaging them. The second is nurturing leadership and capacity building in the area of healthy aging. The third is connecting stakeholders to share and learn from each other. And the last is strengthening data, research, and innovation in the area of healthy aging. And really, it's these last well, especially the last one, but these cross-cutting enablers that we really would welcome the help of MENARAH on. Next slide. Just an example of an activity that we've started to conduct to engage older people. It's a participatory video voice project taking place in all regions of the world. In the Middle East, it's taking place in Jordan. And it'll demonstrate how older people can be engaged and bring older people's voices and their lived realities and perspectives to the heart of this decade of healthy aging. Next slide, please. And this is the process of the endorsement of the decade. The decade hasn't yet been launched. It's in the process of being endorsed. It was endorsed by the World Health Assembly in August, and now will be considered by the General Assembly of the United Nations in December. And then we anticipate that it will be adopted and formally launched then in January. And last slide, please. And we really welcome the launch of MENARAH and really hope to be able to collaborate with this network throughout the decade. Thank you very much.
Very much. And sorry, thank you very much, Chris. A really fascinating presentation there. Now we've got time for some questions. If you have any, remember that you can send them in via YouTube and Facebook in the live comments boxes, and we'll get them answered by our panelists. Shereen, let's come to you first. When did you first start devising this network, and was there a moment where it really became clear to you that this was a critical issue that needed to be tackled quickly?
Yes, thank you very much, Cam. Well, this work has started almost a decade ago when I realized that there is not much work has been done in this area, and I started working with different agencies and writing and publishing and participating in conferences. But several years ago, I managed to be awarded some funding from the Global Challenge Research Fund, and that really initiated a more formal thinking about the issues. And with the support of partners in the region, particularly the American University in Cairo, we were able to hold a number of meetings and discussions. And the time was really opportune, as Professor Hoda put it, that the issues has been started to be realized within policy circles, but it's been realized in a way that it's too challenging, and we can't just, there are lots of efforts and that we could capitalize on. But we need to really put together all these efforts together to be able to connect all the parts of the equation. And the idea of the networks has come in, and we formally kind of developed the MENARAH network, started in early 2019. And then it's really kind of took off. We had meetings with international organizations in the region and globally, and there was great appetite to that. So I'm really pleased that we are in that position. And the focus of healthy aging is really important for us, because it's not, as the speakers, Chris and Dr. Hoda have said, it's not only counting the numbers. We all know that the case exists, that we need to take action, but also take action in a way that is adequate for quality of life and a healthy aging and participatory manner. And I'm very grateful to the many partners who have contributed to the network and made it, reality, and also grateful to the funding from the UKRI, the Global Challenge Research Fund, that allowed this to start.
You talk about taking action, Shereen. Obviously, we see quite a lot in the news about issues like climate change and how that there's a real mission, especially in young people, to tackle this nowadays. Obviously, kind of looking more towards the future now, and probably something that we'll be discussing more towards the end of this panel. But how pressing an issue is ageing populations, and how quickly do we as a community and those especially in the MENA region need to act on this issue?
It is quite a pressing it's a quite a pressing issue because, as Chris has kindly said, that while the previous historical experience of European and developing countries for the move from younger population to aging population to aged populations took quite a long time, like century, the region is some countries in the region, like Lebanon, is expecting this to happen within 15 to 20 years. So there is a huge pressure to make sure that we have some initiatives in place to support the growing numbers of older people. That is in the backdrop of historical high level of fertility rates. That means very large cohorts of people entering old age, and other social structure that is changing. For example, we have a high level of widowhood, so women living alone, even if they were working, they have been retired quite a long time ago. There is a lot of issues around loneliness, around ageism and the meaning of participation. But also there are opportunities, and I think I really need to keep this positive lens. And I want a contribution from Professor Hodor Rashad and from Dr. Chris as well to say something about that, that we also need to focus on the positive, that there are some ways that we can move forward. There are some infrastructure that we can develop further. There are structures within the countries, but also there are resources. So we have a lot of the youth bulb means that we have resources. We have workforce resources if you train them. We have opportunities for intergenerational exchange, and we can learn from other countries, particularly in countries like Italy or other countries in Southern Europe, where they have, kind of intergenerational exchange is an important element of their aged care models and participation of the informal carers. So I would welcome a comment from Professor Hodor Rashad and Dr. Chris on that matter.
Yes,
Okay,
Hodor, let's come to you on that one. Let's unpick that a little bit more and kind of see what the situation is. You're obviously out in Egypt at the moment. Tell us a little bit about the situation out there in regards to this issue.
Well, I think the most important change that we are recognizing generally in Egypt and in the world in general is that the paradigm and the discourse of development is changing considerably. And countries are embracing this type of change. So nowadays, the discourse is on society for all ages. The discourse is more, and the commitment really talks about well-being, talks about leaving no one behind. The idea of equity and that the old age groups are not just one group. They are really different, so in their experiences. So all of this is pushing towards greater concern and more sensitivities to action at the level of old age. If you want to talk specifically on Egypt, I cannot fail to mention that Egypt, for example, has a very ambitious national program called Solidarity and Dignity. When we talk about solidarity, it's more really directed to the poor. And of course, old age are part of that poor. But I would like to focus on dignity. The fact that in Egypt, there is a national commitment to address dignity that is really targeting the older population, this is a very welcome opportunity. It doesn't have the same level of prioritization as the poverty one. But I think with the work of MENARAH, with the work of our development partners, with the next decade that Dr. Christopher mentioned, we have very good opportunities to collaborate with these endeavors. Thank you. I stopped here.
Yeah, of course, the whole reason that we're talking about this and that collaboration being so important and a range of networks here today to discuss that. We've got a few questions that have come in on YouTube and Facebook, and obviously all of you watching, do keep them coming in and we'll get those answered. Christopher, just to come to you first with this one, we've had a question from Maha Gard. She's asked, what do you see are the major social challenges or barriers to senior citizens' well-being across the MENA region?
Older citizens.
Yes.
Yes, yes, yeah. Well, I mean, I'm no expert on the MENA region in this particular regard, but I think there are a number of things that apply probably to MENA region, apply all over the world. One is really awareness of the problem, awareness of all aspects of the problem of healthy aging, and the prioritization of this problem in health policy, in social policy, and so forth. Very often, this is not seen as a priority. So really, making efforts to increase the political priority of this issue in all kinds of ways across the region is probably an important thing. And there are aspects of healthy aging that people know very little about, but that are actually important kind of prerequisites for addressing, for example, the health aspects, the long-term social care aspects, and that's a problem of ageism. That really often stands in the way of the issue getting the priority it deserves, and then older people being treated in the way they deserve. There's so many kind of preconceptions, taken for granted attitudes towards older people that have to be overcome by the general population, as well as by policymakers and decision makers, etc. So those are some of the things. And then, of course, funds and resources and building up the capacity in all aspects of this, the research capacity, and then the program or intervention and implementation capacity, and the service capacity as well. So those are some of the priorities I see as being important.
And Christopher, just staying with you, because obviously we see the World Health Organization is pretty much in the news daily at the moment with the ongoing coronavirus situation. We've had a question from AK on YouTube. He's asked, what challenges are there for healthy aging do you see arising from the COVID-19 crisis?
Well, there's a long list of challenges. As everybody knows, older people are at particular risk, especially when they are in institutions or even in hospitals. And one of the challenges is really equity in this area. Make sure that older people are not discriminated against in any way when it comes to access to treatment, access to care, access to testing. Though that's one of the big challenges. And then there's a delicate balance to be struck between, encouraging the shielding or protection of older people and not further isolating a lot of older people, because as you know, a lot of older people are suffering from social isolation, loneliness, and this has an impact on their health, and COVID just exacerbates that. So striking that delicate balance between protecting older people as a vulnerable group without isolating them further. Those are, again, just a couple of the challenges.
And Shereen,
can I
just to kind of
Yeah,
absolutely. I was going to come to you actually, because the second part of AK's question kind of goes into the MENA region a little bit more, and he's asked, where are there certain countries that may be especially more vulnerable? I don't know if that was something that you're going to discuss, but I'll hand it over to you.
Yeah, thank you, Cam, and thank you for that question. We actually the MENARAH network was able to secure some emergency response fund to do some research in the region around COVID and older people. And just to echo what Chris has been saying, issues around isolation, deconditioning. So not much like what we see in the West around residential care, because there is not much residential care in the region, but there is a lot of loneliness and people living alone. And the fact that older people have been at home for a longer period, and the deconditioning in terms of physical well-being, but also psychological well-being, and their social networks are not available. So we try to use the virtual world that we are living in to create some material for older people and their informal carers through developing a series of physical training exercises aiming at older people at home. So doing some simple physical exercises, using material from around the house, like water bottles and rice bags and things like that, and very simple exercises, as well as creating a Facebook page in Arabic to provide information on the hygiene process, on the tackling and reducing infection, opportunity of infection, as well as maintaining health using simple technologies and like smartphones or other materials. So that project was really, I would say, successful. There was a lot of take up of and views of these materials. In terms of COVID in the Middle East, of course, we know that Iran was one of the early hotspots, as we say, and things are quite has been quite difficult, especially for older people. We are actually in kind of conversation with some partners in Iran to look at this issue and see if there are any data around COVID and older people, and we hope to host this within the MENARAH network website. But otherwise, the declared or the kind of official figures doesn't vary much across the region, with the exception of Iran. And there are lots of kind of differences in the reason. One of our members in the MENARAH network have written about that, Mr. Ismail, and he looked at possible reasons why the disease and infection numbers are low in the region, and there are issues around how people are cared for, whether there are not much residential care, there are a lot of shielding were happening, but also other factors potential related to childhood vaccinations or other issues. But we didn't observe much variation across the region, with the exception of Iran, of course.
Absolutely. Thank you very much, and thanks for sending in those questions. We've had a comment as well from Susan Jim from the University of Bristol saying that care systems, economies and harnessing Africa's demographic transition in Senegal and Kenya is an area they're building at Bristol's new Periovoli Africa Research Centre. So that's another sign of this vast network out there looking to tackle the issue. So thank you very much, Susan, for sending in that comment. Hoda, coming back to you, you're talking about the elderly living out their twilight years in the situation in the Middle East. What about the situation for their carers?
I'm very happy actually that we're bringing in what Shereen termed informal carers, because what is happening is that we are expecting that the family model is coping, and we have lots of anecdotal evidence that the family model is really struggling to cope and to engage with this livelihood needs of the older population. So there is a lot to research and to try to understand in terms not just of the burden on the family of taking care of the older population, but also on the functioning of the older population as an asset. I mean, nowadays, I'll give you an example of COVID and my children. When the children were asked to stay at home and to do the online studying, and the mothers was complaining because they're working and they don't know what to do. The school system told them, well, get in touch with the grandparents, bring in the grandparents. And I thought this was really interesting because we're thinking of the grandparents as an asset. Having said so, I would just like to interject two comments on the definition of vulnerability in our region. I really love the question about which country are more vulnerable. And my question is, what do we mean by vulnerability? The usual discourse is, when you talk about vulnerability, is the idea of poverty and disease, and the idea of the family model that takes care of the older population. We have data to tell us that the percentage of the older population who are living alone or in an empty nest is increasing significantly. So the whole idea that there is a family out there that is taking care of the older, we need to look at our data, and we look to look at how those people are living. In terms of vulnerability, we always think of disease, the burden of disease that the older ages are bearing. But it's not about the disease, it's not about the poverty, it's about dignity, it's about loneliness. If you talk to the older population from the higher social class, and they have the means, and they're not really sick, but what they really suffer from is the lack of dignity. And this is an aspect of our work that we need to understand much better than before.
Absolutely. Hoda, staying with you as well, we've had a question coming in from Suzanne Hamad from the University of Qatar. She's a sociologist there and has supported the Centre for Elderly Empowerment and Care, which is a local NGO. She's basically said that research and grants still don't prioritise looking at this area of ageing and healthy ageing. How can this knowledge gap be filled if it's not institutionally prioritised and research proposals keep getting put aside for more urgent issues? What can be done to combat that, Hoda?
I really think this is a very difficult question because this is what we're suffering from. The agenda of development doesn't have old age central. The funding for research, the national funding for research, again, doesn't have the old age on the agenda. So what can we do? The first is, I think, our development partners, and I'm looking here at the UN agencies. I mean, when WHO is having the call for a decade of healthy aging, 2030, when UNFPA for the Arab region has its own strategy for the region, I think those development partners can join forces with the research community to try to find the fund that is appropriate to be able to really do proper research studies. Without this type of funding, we are forced to depend on small studies, qualitative studies, on the efforts of our colleagues like the center in Qatar that just sent the question. If we don't have the proper funding for large-scale studies, then our role is to push to the forefront some of the findings in smaller localities. Also, our role is to try and link with the media and with the social network to emphasize this aspect and to disseminate the findings. And I remember now that one of the 5 axes of the action plan of UNFPA for the Arab region was linking with mass media and disseminating. So it's really working on the two sides, finding the data and advocating for the healthy conditions of the old age.
Yes, can I comment on that one, Cam, please?
Absolutely,
well,
absolutely.
Yeah. Thank you for that question, because I think, as Dr. Hoda said, this is one of our main problems. And, the agenda, the research agenda seldom look at aging population, particularly in low and middle income countries. And I think it is by these efforts that we're doing and partnering with other agencies and advocacy groups and NGOs to raise awareness and to keep, working with international agencies to say this is a very important topic. We need to research it. We need to research it properly, and we need to conduct adequate, studies with adequate sample size and adequate methodologies. And we hope that research funders will listen to us. But we have a role to play in promoting this agenda and working with the media, as Dr. Hoda said, because the public awareness is very important in terms of raising the priority of these issues. The other point I just want to make, I'm really pleased that we have connections with other groups who are interested in similar research, issues and topics, and I would encourage them to write to me after the event to try to connect and see how we can collaborate, because MENARAH is all about collaboration. And although maybe other groups will be focusing in other regions, like in Africa, there are a lot of common lessons and issues to discuss and to learn from different countries. So I just want to make this shout out here.
Absolutely, and anybody watching who... Sorry, Chris, I've just seen you wanted to say something. Over to you.
Yeah, I just wanted to mention that I'm new in this job, relatively new in this job, but one of my areas of responsibilities is building up research networks around the world to do with healthy aging. I'm focusing in particular on issues of measurement and then creating research networks in the area of social isolation and loneliness and the impact on older people's health, creating research networks to do with ageism and the prevention of elder abuse too. So we are actively in the coming month, in the coming years, going to be creating these research networks in collaboration with research funders as far as we can.
Yeah, thank you very much. And thanks, obviously, for Suzanne for that question and everybody else sending them in. We've got a few more to get through, and we've also got a second panel coming up. So any questions we don't answer at this time, we'll be answering very shortly. Shereen, you're talking about research. Susan, who messaged earlier from the University of Bristol, she's also asked, what are the research priorities which are specific to the MENARAH region? Maybe you can go into that in a bit more depth.
Yeah, I think the MENARAH is starting a fertile ground. So although that we talked about some efforts that have been apparent in the policy level, the research on aging in the region is very limited and very dated. So basically, we are at the point of being open to different ideas. Obviously, we are really keen on healthy aging. We're keen on practice, interventions, and solutions. So we do want to conduct high scientific research, but at the same time, you want to conduct it with the vision that we would create solutions or come up with certain practice and policy recommendations. So we were very interested in the experience of older people themselves. So issues of loneliness, elder abuse, isolation, ageism, the meaningful of participation. So how people, as Dr. Hoda said, there are a lot of people who have the means and health to participate, but there are not enough opportunities to participate. So how we can create opportunities to participate. But we're also interested in the experience of informal carers. So informal carers are completely neglected. They are usually women at middle ages who have other family and have the younger children to look after. They have their employment, many of them in the labor market, etc. So we need to understand the situation and their experience and create also opportunities and solutions to support them and create practice models, for example. We also have an agenda to work with policymakers. So at the policy level, how can we shift the agenda from a kind of poverty focus to a more dignity? And I'm really pleased that Dr. Hoda mentioned the solidarity and dignity initiatives that is in Egypt, and we want to support the development of this and support policymakers in formulating action plans rather than just a policy document, but how that would put into action. So in short, we are quite open at this stage to look at different ideas because the ground is rather fertile and there is lots of opportunities. And obviously within the network, and because we always collaborate and communicate with our partners, we will prioritize these issues, and it has to have some traction within the policy sphere and links to for example, the Arab region strategy for aging or national aging plans. So it has a take-up then in practicality.
Just a final word on policy before we move on to our second panel. Christopher, how do organisations and networks like the World Health Organization, like the MENARAH network, how do they ensure healthy ageing practically? What are some of those solutions that can be come to?
Well, that's a big question. I mean, in this decade of healthy aging, the various action areas are really some of the strategies we're trying to use to improve healthy aging. And I mean, the 4 action areas really are the main strategies we're using, trying to combat ageism, trying to improve the healthcare, trying to improve long-term care, trying to develop communities that foster healthy aging. We have this network of age-friendly cities around the world, which is trying to do that. We have many different activities, but those 4 areas are really the main strategies. And those enabling strategies I mentioned too, and one of them that's particularly relevant to MENARAH is improving data and research. This is a huge gap in this area. And well, I've just finished a global report on ageism, and almost all the evidence comes from high-income countries. And in the area of ageism and in all other areas of aging, we really need more data, more evidence coming from other parts of the world, and that requires really building up the capacity of researchers, of data collection, etc. And that really is one of the top priorities. And try to improve the research to develop interventions, to develop policies and implement policies that lead to healthier aging.
A really exciting time and lots to tap into going forward. Now it's time, unfortunately, to say goodbye to Professor Hoda Rashad and Dr. Christopher Mikten. Thank you both very much for joining today and answering all your questions from those who sent them in on YouTube and Facebook. Do keep them coming in. We've got a second panel coming up. Shereen is going to stick around for that one and we'll be answering those questions and we'll be continuing with our MENARAH network launch. Don't go away.
The family and the community are the main providers of informal care in the region. This feeds into other social norms that has to be taken into account when it comes to policy making. There is also much to be learned from the global community. In countries like Italy, where intergenerational support remains a core element of its aged care model.
Government, which in Italy is primarily the regional government, but also at national level, in other countries could be the relevant one, can make resources available to support older people in terms of cash for care on the one hand, schemes which can be used also to buy on the market some services, but also to improve the delivery of care through daycare centers. They are increasingly important, especially in the field of dementia we see in this country. At the same time, I think that even the volunteer networks might benefit from some support and recognition by the state, as this would make them even more effective in reaching out to all most vulnerable older people.
ويقدر يشتغل بس ما لقاش حاجة حتى مناسبة، مع ان هو ممكن جدا يشتغل في حاجات كتير قوي، يتعامل زي نوع من النشاط حتى ولو مش هنقول بفلوس، بس تبقى حاجة رمزية، لكن هتساعد جدا 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 ان الناس دي تعيش وتحس انها عايشة، مش مجرد ان احنا ناس كبار يعني يقعدوا ياكلوا يشربوا يناموا، لا هو يقدر يدي، وعلى فكرة ده اللي هيخلي صحته احسن، هيخليه يتحرك اكتر، والحالة النفسية هي هتخليه افضل.
And we know we have so-called cyber groups of children or youngsters helping older people in using these new technologies, and that's very helpful. So this is very good in one direction. At the same time, it is also a learning experience for many younger people to understand and realize for them that it's not so easy for everybody to use technologies. They have been born with them. They are digitally natives, as we know, and therefore in this interaction they learn a lot also. So it's a two-way learning process.
طبعا انا عندي انترنت في البيت وعندي ايباد وعندي التليفون اللي هو التاتش ده، بس بكلم باولادي اللي هم بره على التليفون.
طبعا الناس الكبار لما بيقعدوا مع اولادهم ومع احفادهم ويحاولوا ان هم يقولوا لهم خبراتهم، بالتالي بيبقى في مردود فعل من الاولاد والاحفاد فيما يتعاملون فيه بالوقت الحالي. يعني هم التقدم بتاعهم بيعود على الكبار برضو، لان هم بيستفيدوا من خبرات الصغيرين، زي الصغيرين ما بيستفيدوا من خبرات الكبار، برضو الكبار بيستفيدوا بالنظريات الجديدة والخبرات الجديدة والتصرفات اللي بيعملوها الأصغر سنا.
The intergenerational perspective is very important in Italy, and because Italy is a familistic welfare state. So for us, family is important, and is within the family that takes place the discourse, the intergenerational discourse. That from my fieldwork, I realized that there are places in which the young and the old meet, and they are helpful for each other. For instance, libraries. We have in some at regional level, some projects in which they developed activities with youngers. So the young people go after school for their homework, and the old people are there to support them in doing these activities.
يعني اللي احنا شايفين اللي هيفرق في حياتهم quality of life للناس الكبيرة ان انت توفر لهم حاجه باشن بالنسبه لهم. الحاجات دي مش لازم تكون يعني ممكن ليها صور كتير. ممكن تكون نادي ثقافي، ممكن تكون مكان يقروا فيه، ممكن يكون مكان يتجمعوا حتى فيه كويسه بيشاركوا خبرات. بس وجود هدف، يعني وجود حاجه يسعوا لها حتى ولو كانت بسيطه، ده في حد ذاته هيستهلك جزء كبير من الشغف عندهم والحب ان هم يعملوه، فهيخلي لحياتهم معنى تاني.
The person has to be at the center of the attention, and the attention has to be towards the patient, towards the person. The patient has to be active. The patient, the individual, has to be very active on its own her health, and to achieve that is something that needs a lot of effort from the system. Okay, so it's not because we tell it is at the center. So it's not a matter of telling that; it's a matter of realizing that.
المشاكل بقى الأخيرة هي في الرعاية الطبية، ودي ان احنا بنعاني لحد كبير ان انا نلاقي حد يكون دكتور فاهم او كويس يقدر يجي لنا البيت، لان احنا ساعات بنتعرض للموقف ده كتير، وللاسف ما هواش السيستم عموما مش مهيئ قوي لده، وان انا الاقي حد يرعاهم مؤهل ان هو يرعاهم واثق فيه ان هو يرعاهم بالرعايه الكافيه، دي مشاكلي اغلبها يعني.
Welcome back to the launch of the MENARAH network. Professor Shereen Hussein has stuck around, and we've had some great questions coming in from you watching on Facebook and YouTube. So do keep those coming in the live comments panel, and we'll get those answered by our second panel, which I'm happy to say joins us on the line now. We've got Dr. Sarah Salman from the United Nations Economic and Social Commission for Western Asia, and Professor Marvin Formosa from the United Nations International Institute on Aging. Sarah, I'm going to hand over to you first for your short introduction.
Thank you for that, and good morning everyone. I'm Sarah Salman, the Regional Advisor on Population Affairs in UNESCO. I'm happy to speak today at the launch of MENARAH, an initiative we're very, very excited about because it comes at an extremely timely moment for the region. The region is witnessing a fast population aging, as demonstrated in the presentation of my colleague Christopher from WHO. This reality leaves a very tight window for countries across the region to prepare and ensure qualified life for their older population. Despite some policy developments, policies across the region remain fragmented. Older persons continue to be heightened risk of vulnerability, exclusion, and being left behind. At UNESCO, we are engaged with several governments to support them develop coherent and inclusive aging-related policies. Based on this experience, we can draw a few remarks. First, some serious efforts are needed to mainstream aging across policy making, across the different sectors, from health, education, transportation, accessibility, housing, e-governance, and to name just a few, in order to address the urgent priorities of older persons. And while there has been progress in some countries, policies need to recognize that older persons' rights are human rights, and that's first and foremost the main message, in order to address the person's needs and issues. Third, a life cycle approach to aging really is needed in most countries, recognizing that preparing for healthy aging begins at birth, and that income security begins at the early years of the career of everyone. This eventually will result in some behavior change and in societal norms that currently perhaps are not as well endowed in that area. Finally, data continues to be significantly lacking in our region. It's inaccessible and it's very difficult to have regional comparisons. Therefore, there is a need for disaggregated data to develop responsive and evidence-based policies and measures that address the needs of different groups of older persons. At ESQA, we have tried to develop the evidence base. The last report on aging with dignity in the Arab region provided demographic projections that indicated the speed of the aging transition in the region and provided an overview of the socioeconomic situation of older persons today and in the horizon of 2030 and 2050. The situation is indeed alarming. Older persons are largely excluded from social and health insurance and risk poverty and ill health. Older women and older persons in rural areas are particularly vulnerable groups. Changing social norms are threatening intergenerational support and changing the role of families, which continue to be the main source of support. And here I echo what Dr. Rashad said in the earlier panel. In light of this perhaps dark reality for older persons in the region, initiatives such as MENARAH are urgently needed. I went through the platform, and indeed it holds great promise of bringing together the research community to provide evidence, address the immense challenges, and guide the research and policy agenda on aging in the region. We all need to do our part, academics, NGOs, and governments, and working together is the way forward to ensure a better life for older persons in the region. I want to end my brief remarks by wishing everyone an early Happy Older Persons Day, and that we hope we can make a difference. Thank you, and over to you.
Thank you very much, Sarah. Marvin, I'll hand over to you to say a few words.
Yeah, good morning to everyone, and thank you, Cameron, for this invitation. Like Sarah, I'm very excited to be part of this MENARAH organization. Its aims and objectives are very much, they overlap a lot. They are much in line with the ethos of the United Nations International Institute on Aging. This institute, which is shortened to INIA, we refer to it as INIA, was established in 1987, and the rationale underlying its founding is very clear. Basically, we know, I mean, the gerontological community knows that whilst the so developed countries, it's not a jargon I like, I prefer high-income countries, took about 100 years, a century, for their populations to become an aged populations. So they had a lot of time to, let's say, prepare and fine-tune their governments, welfare organizations, even the mentality of all the people themselves. Many countries, the so-called developing countries, or in my preferred jargon, the low-income countries or countries with economies in transition, they will only take about 25 years, a quarter of a century, to to transform themselves into aging populations. So basically, our institute acts like a bridge between the high-income countries who already have very strong aged populations and countries who are just starting to start this journey. However, the journey of these countries will be brief in the sense that it will only take them, again, I repeat, a quarter of a century. So the rationale of INIA is to go into about 150 countries and work in basically training the trainers. There's so much thing to do that we cannot train every person who is going to work with older people. So our ethos is to train the trainers in the hope that the trainers will go then back to the place of work and then train the others. Training in gerontology, geriatric care, dementia care. Dementia nowadays it's another enormous challenge. And so we go into countries as diverse as the Dominican Republic, to Nigeria, Belarus, China, Philippines. We go to about, we have 15 training programs every year. We try to do one training program every month with some other training programs as a bonus. And I'm very happy that Sarah mentioned the term human rights, because to conclude my brief introduction of the Institute, which I direct, is that an informal maxim, an informal saying of our institute is that human rights do not become obsolete with age. Because although we have the Universal Declaration of Human Rights, unfortunately, in all the countries in the world, many other persons' human rights are not safeguarded. And this is not a matter of whether a country is more industrial than another, or whether it is more developed than another. In all countries are afflicted by ageism. And one result of ageism is that older persons do not enjoy equal citizenship rights as their younger peers. And so basically, to conclude, the International Institute on Aging has a pragmatic wing, of course, because we provide training, but at the same time, we also work in advocacy. And by advocacy, we try to bring more awareness to the need for older persons to have their human rights safeguarded, irrespective of their age, whether they're in their 60s or whether they are centenarians. Thank you, Cameron.
And thank you, Marvin and Sarah, for your quick comments. And obviously, thank you to all of you watching at home and sending in your questions. We're going to come to them in just a few minutes' time, so do keep sending them in and we'll get them answered. But first, here's a final video clip.
We need to understand those caregivers need to be taught or increase their capacities or skills to identify where is the tipping point, how to deal with juggling all these duties that she has to do.
بالنسبة بقى للي بيراعوا المسنين، مين يراعيهم؟ يا ريت لو كان يبقى في مثلا أنشطة مخصوص للي بيراعوا دول. ممكن يكون مثلا جروبس، ممكن يكون جمعيات بتوفر لنا معلومات، بتوفر لنا وسائل ترفيه مخصوصة لينا، بتوفر لنا تدريب معين، إرشاد، يسهلوا علينا مثلا حاجات. ممكن يظهر سيمتومز على مثلا اللي معانا واحنا ما نعرفش ان دي مقدمة لحاجة لا قدر الله تبقى مش كويسة، لان احنا في الاول وفي الاخر احنا المسؤولين عنهم بعد ربنا طبعا.
And even for the service caregivers that for hire, we don't have that concept in Egypt.
في مجتمعنا طبعا ثقافة ان حد يتحط في دار مسنين يعني هو كده فاقد الأهلية، هو ملوش حد يهتم بيه، هو سنينه اللي ضيعها في تربية ولاده راحت هدر، ملقاش اللي يسقيه كوباية مية أو يناوله دواء، لدرجة ان هو يحتاج يروح دار مسنين حد يهتم بيه.
ده يعني شكل في حياتنا تأثير مش قليل، صعب جدا، وساعات ان احنا بنقعد بفترات طويلة جدا من حياتنا، جزء كبير جدا من حياتنا عشان نحل مشاكل اكتر من ان احنا حتى نقعد معاهم ونراعاهم ونساعدهم بوجودنا.
And we need to understand how stressful is this, because those are they're going to age. With that stress on them, eventually their life in old age is going to be more stressful than their mothers, and we're going to go into a vicious cycle.
واحنا بطبعنا كشرقيين بنبقى مرتبطين جدا باهالينا، وبرضو الكبير له احترامه ولازم نبقى كلنا متواجدين حواليه، وده برضو ما يمنعش ان انا برضو عندي مسؤولياتي بالنسبة لبيتي واسرتي غير مامتي، فده طبعا بيبقى لود عليا، لكن انا بحاول ارضي جميع الاطراف ومش لازم انسى نفسي انا كمان، واتمنى ان اللي حواليا كمان يعني يدوني المساحه بتاعتي علشان املى الخزان واقدر اديهم هم كمان.
We look at health not disease. So we look at health in terms of the well-being aspects of individuals' livelihoods. And we're very concerned, generally speaking, that in our region, the health interpretation is very much a healthcare only interpretation. We fully recognize the importance of healthcare, and we fully recognize that we have major challenges when it comes to healthcare. But we also understand that we need complementarity of efforts in order to avoid the high burden of disease and in order to address ourselves to the healthy population.
Our goal is that people will network together, work together, try to move the narrative on aging and healthy aging, and particularly around healthy brain aging. But many of our fellows come from regions where they don't even have basic data. We can't identify the prevalence of the disease. We're leaning on very small studies that are not reflective of the group. And from our standpoint, if you don't know the problem and you don't understand the challenges, and particularly the economic challenges, policymakers are not going to be that interested. They need to know that it's a disease that's important. They need to know the context within the care. They need to know how they can best move their policies forward in a productive way to help.
What is important is to have a vision that is multi-annual, 5 years, 10 years, 20 years after. And of course, if there is another locality in the same region that has a different approach, there's a lot to learn from the other locality and to exchange parts of the initiative from one place to another. Of course, everybody will be different. The journeys are different. The important is that there is a journey.
Everybody talks about the level of health care for the older population. This is a level that we need to cater for. But we have also discussed in terms of system change, the social support. We have to discuss the counseling. We have to discuss how community can be engaged to support the old age. In doing that, the equity lens has to be very strong. Because one of our concerns, generally speaking, and it will apply to the old age, is that we treat the old age as one group of population. What really needs to happen is to differentiate between different social groups, their different types of need, and the different type of services provided to them. That kind of an equity lens has to be mainstreamed across all our discussion of the old age in Egypt. Since I see this as the beginning of building momentum, let's do it right this time.
Population aging must be viewed as an asset to any society. An older generation should have more opportunities to participate, not less. To fulfill the full potential of this age group, families, NGOs, policymakers, service providers, and older people themselves need to engage. And far more data on these issues need to be collected. That's why MENARAH provides such an exciting opportunity. It's a platform to enable these key discussions and bring people together to improve the lives of older people and their families throughout the region.
Very exciting opportunity indeed, as Shereen said in that short video. Now let's get stuck into some of those questions that you've been sending in, and thank you all obviously for doing so. You can keep sending them in, we'll get them answered by our panel. Sarah, we're going to come to you first. We've had a question come in on YouTube saying, do you think there may be gender influences on care strategies in the MENA region? I'm really sorry. As I said earlier on, we are experiencing a few technical difficulties. We are going to try and get Sarah back on the line shortly. Marvin, let's come to you with this one first about the issue of gender. Are there gender influences in the MENA region when it comes to care strategies?
Well, absolutely. I mean, gender influences are present everywhere in all countries and in all regions. Well, in the sense that it is, but there are women are expected to provide much of the informal care, but different regions also have different familial arrangements, and some are patriarchal in the sense that it is the family of the son, of the eldest son. Some other countries would prefer that it is the youngest daughter. So yes, gender influences are present, yes. And of course, there's nothing wrong with one's cultural formations. I mean, all cultures have a right to distribute the informal network of care as how they seem fit. What we work on, Enya, is that the people on the ground, but even policymakers, are aware that there might be sometimes an imbalance in the sense that we know that even perhaps for the sake of an example, even women who would want, who are willing to take care, they may experience burnout, for example. So it's not just a method that we try to make or sort the imbalance, but I think what India does mostly is that we ensure a fair deal for those who are providing care. That is, in my opinion, very important. That those who are providing care, the informal network here, we are referring mostly to children, daughters, most of it, they could also be sons, and they have all the support that they need. And basically, it is in the government's interest to provide informal carers with as much assistance as possible. Because if informal carers cannot continue doing this care work, then of course it will be a major catastrophe, because then one would need to find formal carers to do their job, which of course would mean a lot of financial injection.
And we got Sarah back on the line now. Sarah, just maybe you can help with the second part of AK's question that came in. Marvin talking about the expectations and those influences of gender on care in the region. What about kind of the age within that as well? Are younger women and men, will they have different expectations of what they need to provide in terms of care in the region as opposed to maybe more middle-aged male and females?
Well, we are seeing definite changes in the social norms, in the family structures, in the expected gender roles of both men and women, which affects the care part. Women, and here we base our opinion basically on some of the anecdotal evidence that we've been collecting from the field and research we are doing in some of the countries, where the women in their engagement in the labor market have been juggling too much between care for the families, the children, and older persons as well. And this change in the social norms and in the gender roles in particular have had their effect on the care economy for older persons. The biggest role for the care economy of older persons was traditionally played by women. And given now that they struggle between their different responsibilities, the new policies need to pay attention to that, need to gear basically their support in that direction. And here maybe we can link two worlds together, both women empowerment and older persons care. So from the one side, looking at the role of women and how they need the support to provide the care that is required of them. And so that's one dimension. The second dimension is the care for older women per se. All in the region are more vulnerable. A lot of evidence point in that direction. They're more likely to live alone in older age. They're more likely to suffer from income insecurity. The vast majority of them are left out of social protection platforms. They are less likely to access healthcare services that they need. And therefore, such a gendered view of policies and policy making is definitely required. We have seen some progress in the region in that, to be fair. In some of the countries that have recently adopted older persons policies or related policies per se. However, if I am to speak and generalize about
the region or across the region, we would say much more effort is needed in that direction. Thank you. Over to you.
And Sarah, we've still got a connection with you, so we're just going to ask you another question while we've still got you on the line. We've had Suzanne Hamad, who was in touch earlier on via Facebook from the University of Qatar, and also she supports the Centre for Elderly Empowerment and Care. She's made a point that there's still tension between the healthcare sector and the civil society sector with it throughout the Arab region, and that both those sectors work alone. Collaboration's unfortunately lip service. Obviously, not to generalise, it's quite a wide issue, and there is going to be some generalising there. But what can be done to make sure that it isn't just, as she says, lip service?
Well, this is a tricky question. We do have a lot of efforts that are being done by countries, by governments, by research community, by the practitioners, by the NGOs. Yes, while some of it continue to be maybe ink on paper as opposed to pragmatic programs that actually cater for older persons' need, I think it is a step in the right direction. A lot more effort is needed in terms of securing funding. A lot of the countries across the region struggle with that issue. While they might have good visions and good intentions, securing the funding that is required to translate those visions into reality, into programs that actually cater for older persons, empower them and protect them, continue to be significantly lacking. And here we must stress on the issue of the public-private partnership as a main source for support, as a main source for funding as well, and as a partner in implementation. That's one dimension, basically, the public-private partnership. The other one is more political will, and that is something that we have been trying to garner by working closely with countries and governments directly, but also by encouraging regional dialogue among the stakeholders to try to basically perhaps widespread the best practices, the lessons learned, identify the common challenges and the common issues to make caring for older persons a reality and not just a lip service.
Suzanne's also made a point of terminology and how it's important in the media that when referring to the older population that there is such a wide age range there, and as we're seeing, many societies are getting older as well. So there's quite a broad spectrum of age there. Shereen, how important is that in terms of the media and getting that message right, that it's not just one homogenous group?
Yeah, thank you, Cam. I think this is really important because we have a variety of abilities and age groups within this age group. Obviously, a lot of the research is conducted on 60 or more or 65 or more, and this is traditionally. And obviously, there are a lot of efforts of the United Nations, for example, to come up with new definitions of what constitutes aging, and how we fare with the life expectancy in general, and how we can view age differently in terms of the remaining life expectancy, for example. So if you're talking about life expectancy in countries like Lebanon of 83 among women, then 60 years old, you've got quite a lot of years to live, and we need to ensure that these years are lived in a healthy way and fulfilling and dignifying way. However, we need to also think about the diversity of older people, not only in terms of age, but in terms of socioeconomic class, in terms of the life trajectories and history and cumulative disadvantages, and think about creating opportunities that is meaningful, rather than we see, for example, certain stratas of older people who are less educated that continue working until very late in life, but this is not because it's fulfilling happiness or well-being. It's because they have to do it for economic reasons. And I want to touch base on the issue of gender because this is really important, and it's important in relation to both the older populations in this region as well as the informal carers. Even that we're seeing signs of changing gender norms. This is at the younger generations, and we will see this happening. But currently, the norms are for
families, for daughters, if they are around, because it's really important to realize also the socio-demographic changes that countries are facing. It's the care element of it, the hands-on care is the daughter kind of duty, although that the sons would provide financially. So this is really important. And also they are left without any means of support. We saw in the clips that people really want to understand how to care for their parents better. They want to know, to have some form of support. They are facing a lot of burnout and stress. And on the other coin, side of the coin is older women. So we have traditionally large age gaps between spouses. We have life expectancy higher among women than men. We have remarriage rate is much lower among women widowed. So we end up with a lot of women at old age living alone without a partner, without a family close by because of migration trends as well. So they are really all of these are very important, and it comes to differentiate between different groups of older people, whether it's by age or gender or social class or access and ability and mobility in general. So these are very important factors. And I'm very pleased that Sarah has mentioned the International Day for Older Persons. And it's so fortunate that we are launching the MENARAH network. It is on Thursday, the International Day for Older Persons. And we hope that this would, generate interest as well in looking at the diversity of older people living across the world and their diverse needs.
I just want to read out a testimonial that's been sent in from Gammon Omar, who's the director of the Elderly Department, Ministry of Social Development in Palestine. He says the launch of the new network, MENARAH, is a wonderful idea and deserves all respect, attention and follow-up because of the elderly in the Middle East and North Africa live in difficult health and social conditions, and launching MENARAH will lead to more joint work, raising awareness and the exchange of experience between people throughout the region. The ministry would like to thank MENARAH for their efforts in the field of ageing and respects the efforts in launching this important network. So a lovely endorsement there from the Ministry of Social Development in Palestine. Shereen, just staying with you, we've spoken a lot about solutions and the outlook at this time. If nothing is done, if there isn't any action from policymakers, governments and organisations in this area, what will the economic, social and cultural landscape be throughout the region?
There will be, real implications, real negative consequences. We will see the burden on women and informal workers increase. We will see their participation in the labor market decline. We'll see the well-being of older persons is deteriorating, and that will mean additional cost on their health systems. And we will see quite lost opportunities in terms of capitalizing on lots of expertise, lots of talents among older people and among the younger population. And we might also see real problems in terms of maintaining a healthy life and maintaining a meaningful life. So there are lots of costs, not only economical costs, but societal costs, which is really important. And as we spoke earlier, this thing, the population aging is continuing to happen. So we are talking about generations after generations, and we are talking about a very short window of opportunity where the countries will see both younger people growth, the youth bulge, as well as older people. And I see this as a real economic opportunity to generate taxation, to generate cash for the countries, and to use them as labor force, because this is something not available in high income countries, for example, where they have shrinkage of the population within the middle age groups that generate income. So there are real opportunities to harness here, and the cost and the risk, if nothing has been done, is very, very high and significantly high, and morally unacceptable, and not only economically only.
Absolutely. Marvin, let's come to you now. What are some of the changes that we're already seeing throughout the region in relation to this, and maybe also kind of combining this with a question that we've got from Susan, who said how the impact of MENARAH's multi-stakeholder partnerships be monitored and help oversee these changes going forward.
Yes, today we are speaking of not of the welfare state, but of the welfare society. And this is for two reasons. I think the global community underestimates the impact of population aging. And we underestimate this in two main ways. First, when I say we, I mean the people in general, still define care in an acute sense. So basically, they think that one should care for the body, and then everything is fine. The person will be discharged. But that is a very narrow definition of care, and it is a definition of care which works well with acute health situations and with younger people. So when we care for older people, we have to care for them holistically. And another issue here is the numbers. The numbers will increase exponentially. So although we tend to speak of percentages in many press releases by the United Nations, there are always a lot of emphasis on percentages. But aging is also a word of numbers. And basically, the numbers of older people, which will be present in many of the North African and Arab and Middle East countries in about 2 decades' time, they will be, exponentially larger, and that means that, of course, one's efforts must be higher. Combining the two together, the element of care and also the numbers of older persons, older persons may find themselves in frailty, for example, for a long number of years. So, for example, one aspect is end-of-life care. And whilst in the past, end-of-life care might have meant a couple of days, end-of-life care today, because we are successful in making older people live longer, it may stretch to even months. So the human resource of taking care of older persons is enormous. Just an example, I mean, life expectancy of a person with dementia can easily stretch to 8 years, sometimes even more. So basically, you are dealing with a situation of care where the informal network alone will not be enough. And that's why we speak of welfare society. Now, you mentioned the term monitor. Yes, it's very important that civil society and the government and even the informal carers, we monitor each other, monitoring in the sense that one has to act on one's promises. And that is why it is very important for countries, and INEA works directly in such an area. It's very important that countries have strategies, have healthy aging strategies, active aging strategies, dementia strategies. Of course, there are global strategies issued by WHO, by the UN, but then each strategy has to be tailor-made, has to be contextualized for sometimes not for each different country, sometimes even within a country, there might be regions that would necessitate different contextualizations of global strategies. And so I think, we have a tall order in front of us, and anybody working in the field of aging will tell you that, it's a bottomless pit of energy and resource. Thank you. Over to you.
And Marvin, your position obviously gives you that international insight of what's going on across the globe. What tips and ideas can countries in the MENA region gain from other countries around the world when it comes to healthy aging?
A difficult question, but if you really have to put me, with my back against the wall, I would say dialogue. Dialogue is very, very important. In the number of countries which I visited, I always tend to experience two things. First, fragmentation, in the sense that policy for older persons tends to be fragmented in different ministries or in different NGOs. One NGO may work in mental health, and another NGO may work in social activities, and they are working in silos. And that is, of course, exactly what we preach from day one, that taking care of older persons requires a multidisciplinary approach, a multifaceted approach. And therefore, the worst thing that one can happen is for people to work alone, for people to work in silos. And that is why, if I have to choose just one element or a principle which will hopefully improve the quality of life and well-being of older persons, would be dialogue. Because with dialogue, there comes empathy. And when one empathizes, then one can really work for your client, your patient, the person whom you are servicing. Without dialogue, it's like burying one's head in the sand, and of course, not ensuring that people's expectations are met, because even people's expectations, they change over with time. So what would have been considered as good quality care 10 years ago, today it might not be good quality care, not because there's something intrinsically wrong with it, but it's because society's culture, norms, values, expectations, they change. And of course, then what constitutes good quality care needs also to change accordingly. And this can only be done with a wide-ranging dialogue. Thank you.
A question for Sarah. Are there any special interventions happening specifically for older women, particularly women with disabilities?
In the region, there is a growing tendency to target persons with disabilities through programs and through comprehensive programs. And there is an effort to engage or to target women with disability in particular. However, I cannot speak based on evidence at this moment, but we do know that there are initiatives that are going on. We don't know the scope, perhaps, of how these initiatives are able to target those that are most in need. And here I echo Shereen's point on the need to collect more and more evidence from the region. While we, perhaps know of some programs or of some policies that are ongoing, but we do not know in reality the impact of those policies, the reach of those policies, the ability to target the most vulnerable among the beneficiaries of those policies. I think a lot of effort, and here we hope that platforms such as MENARAH and the research community can come in to support the evidence, of course. But if I may, I would like to just maybe comment on the issue of numbers that Gavin just raised. And in the region, we expect the number of older persons to rise from 32 million today to exceed 100 million in 2050. That's a significant increase, regardless of the percentage of the population. 100 million older persons in 2050, that is huge. And the preparation to have the care economy necessary for the older persons in a few years, really in a few decades, is significant. So unless we start the work today, we are risking putting 100 million persons in a few decades at risk. And I'm happy that Gavin raised that point, and I think it's important to pay attention to. Thank you.
And bearing that in mind and hearing some of those, hearing about the need for greater dialogue from Marvin and the platform that with MENARAH and all these networks coming together, if greater funds are available, there's more research into the area and kind of more compassion, I guess, from society as well to look after their elder people. What can we expect to see if that was all to come together? What can we expect to see the picture in the MENA region in the next decades, Sarah?
Well, we hope that we would see a better picture in that sense. We would hope to see more engagement by the different stakeholders, more cohesive work, less siloed approaches, as Marvin had mentioned, and basically a better dignified life for older persons that don't risk the issues of ill health, of isolation, of poverty, and exclusion in general from the societies that they live in. It's a gradual work, and we need to recognize baby steps. We need to recognize when a positive change happens, just as we recognize the challenges that we face. So concerted efforts over the span of the next decade will hopefully result in a better well-being and dignified life for older persons.
And we're just running close to the end now. Just a final question and a final word for Shereen. There may be research, or we know for a fact there are researchers, carers and policymakers watching. We've had a number of testimonials and questions coming in from all across the region and the world as part of our event today. How can they get involved in the network and find out more about the issue? Where can they go?
Right. Well, first, I'm really grateful to all the testimonials that we've been receiving. This is really heart-filling and makes all the work to put this network together worthwhile. I also want to thank Marvin on pointing out to the fact of the importance of dialogue. And this is part of this network is this dialogue and allowing a platform to talk between NGOs, policymakers, researchers, and we, from the very beginning, put in the heart of this voice older people themselves and carers, and we will continue our concerted efforts. In terms of reaching out, the easiest way is to contact me directly, and we will have communications. We would be more than happy to create a new page of our partners and to make cross links between research groups, because it's all about really collaboration and knowledge translation and working out how we can do things together rather than again in silos. Sarah has pointed out to baby steps, and I think we have to be very realistic. There is a mountain of challenges in front of us, but the starting point is to realize the challenges, to realize that this mountain exists, and to then start tackling it one step at a time, and to prioritize the work. So I'm very hopeful with this collaboration. We have a very good contributions from esteemed panelists and the support and endorsement of many organizations, that we hope that we capitalize on each other's work. We capitalize on the Decade of Healthy Aging, we capitalize on the UNESCO work, on ENIA's work, on the researchers on the region, that exists, but it needs to be collated. And I would be looking forward to contributions from other groups that I'm, either was aware of or I haven't been aware previously, and to make connections and to meet people and see how we can collaborate further. I'm very grateful to the panel today. It has been a fantastic event, and we pointed out to many important issues, and the timing with the International Day of Older Persons on Thursday is quite opportune for us to raise these issues at that point of time.
A mountain to climb, as you said, but with a network like this and many other organisations and individuals helping be able to tackle it, I'm sure. Shereen, Marvin and Sarah, thank you very much for joining in this panel, and obviously thank you to Hoda and to Christopher for joining earlier on. And a big thank you to you at home for tuning in and sending in all your questions. Hopefully we've been able to answer all of them. If you want to find out more and continue the conversation after this event, you can go to MENARAH.org, where there are plenty of resources, reading activities, videos and contact details as well. It just leaves me to thank you once again for joining, wishing you well for the rest of your day, and goodbye.